Good afternoon, everyone. Happy post-lunchtime. My name is François Brochet. I'm a faculty member here, and it is my pleasure to introduce and moderate this session with Jerome Contamine. So, Mr. Contamine has been Executive Vice President and Chief Finance Officer of Sanofi for the last 4 years. Prior to joining Sanofi, he had a distinguished career also as a top finance executive, both in the public and private sectors. Indeed, he started after graduating from the most prestigious graduate schools in France. He joined the French Cour des Comptes as a State General Auditor in 1984. And he subsequently joined the corporate world by going to work for Elf Aquitaine, a major sort of oil company in France, which throughout sort of merged with Total to become the Total Fina Elf company, at which he stayed until 2000. And then he joined Vivendi Environment, again as CFO. So again, a very distinguished career as a financial executive. Now Sanofi, his current employer, is, whichever you look at it, a large global company with $35 billion euros in sales, a third of which in so-called emerging markets, and 6 of which in diabetes-related products. Sanofi is also a large presence in capital markets, being primarily listed in Euronext Paris, with a market capitalization of $125 billion and as well as cross-listed at the New York Stock Exchange. With commercial presence in 100 countries and products being distributed in 170 countries, definitely a global company that Mr. Contamine is going to say a lot more about. So with no further ado, let's welcome Jerome Contamine.
Well, good afternoon, everybody. And first of all, let me say that I am very impressed to be here giving a short lecture in these prestigious areas. I must say that maybe some of you have noticed that we have acquired now 2 years ago a company called Genzyme. And Genzyme is actually having one of these iconic facilities somewhere just along the Charles River, just in between Harvard and on MIT, actually. So they were pretty clever to maintain the balance. It took us, and clearly we were getting closer to Harvard, and it took us $20 billion to invest and to get close to Harvard. So hopefully it will not cost me as much to send my kids to your schools, and the scholarship will be not as expensive as acquiring this company. Okay, I have prepared some slides because, generally CFO likes to have slides. Also because I saw that just after lunch it could be a way to keep you awake. I must say that having had a chance to share with you the lunch bag, I just forgot that we were in the US and not in France, and probably, still you will be awake with what you had to eat for lunch. But anyway, I will now start. I think the plan is clearly just to try to stick to the 20 minutes frame which was given to me, and like you really to feel free to raise questions. Well, it's pretty difficult to know which angle of view I should take to take this 20-minute presentation. But maybe I should give you first, because I'm not necessarily that familiar with this industry, to just give you a few figures. The pharma industry worldwide represents around, or the pharma business represents around $600 billion market worldwide, to which you could add some adjacent markets, such as the OTC markets, another 200 billion, or the vaccine markets, another 30 billion. So, roughly speaking, you could say something like $800 billion or so, out of which 40% is here in the US. So, by far, the US, and maybe it's not a surprise to you, is the largest consumer of pharma drugs and the largest consumer of health in general, when the health spending ratio to GDP is close to 16% here in the US, as compared to a lower ratio elsewhere in the world, including Europe. But interestingly as well, if you look at the 10 largest pharma companies in the world, these 10 are all Western companies. There is so far no emerging market, emerging company, or company coming from the emerging world having got the size of the Western companies. And interestingly as well, out of the 10 largest pharma companies by market cap, and you could take sales as well, 7 are European and 3 are American. So when the US market is by far the largest market, the number of companies still, in terms of size, which are present in the market, are more represented on the European side than the US side. So why I make this introduction is just to tell you that we, in an industry which tends to be a global industry, we need to think both on the European and the US market. But clearly, I think that the European companies have shown in the past years, in the past decades, success to tackle the global demand and to tackle what is considered as the most demanding market, which is the American market. The third point as an introduction I'd like to emphasize is that now if I look forward and if I look at where the growth is coming from, well, 70% of the growth is coming from, by now to 2020, from emerging markets. So we have basically a market which is 40% American, 20% European, 10% Japan, and the other 30% being spread in the rest of the world. It's a market where 70% or the 7 of the 10 largest companies are European-based, and it's a market which is going to grow through emerging markets. So just to tell you a bit, where are the challenges which we are facing. So with that, I will now try to move with my presentation, and I don't know if it is the right. Here, I need to know which one I need to use. Okay. Yeah. Okay. So, because surprisingly, you don't have the same graph on the top laptop here, but that's interesting. Okay. So I would like to give you a bit of a, after this introduction, a bit of a feeling of where this industry stands. Or used to stand a few years ago. This is an industry which has been extremely booming over the 80s, the 90s, up to the beginning of this century. So it's an industry which has been growing very fast, which has taken advantage of a few discoveries, or a number of discoveries, which were done in the 80s or beginning of the 80s, and driven through the blockbuster model, huge growth. Just up to recently, okay, thank you. Up to recently, the largest drug in the world was Lipitor, being produced by Pfizer, which representing on its own $12 billion sales. And the second one, interestingly, was Plavix, which is a Sanofi drug, which was representing just $10 billion. But these big drugs have just, by coincidence, come to patent expiry. And this industry is living from innovation, patent protection. And when you get off patent, then your drug gets public. And in the main markets, and particularly here in the US, you enter into fierce competition with generic competitors, because then the market is open to competition. And quite over a few weeks, you lose, let's say, 90% of your sales. So when you used to do something like $10 billion sales on one drug, just after 90 days, you are somewhere down a few, let's say, $100 million. No, this is the challenge, or what we called in our industry the patent cliff. Then, of course, the rule of the game is to bring new innovative drugs and hopefully to make them another blockbusters. And it's fair to say that over the last, let's say, 10 to 15 years, we failed to bring as many blockbusters as we used to do. So, for instance, if you take the number of drugs which are being approved yearly by the FDA, the number of drugs which were approved around 2000 were around 60 drugs per year, and it went down to something between 25 and 30 per year during the last decade. So you can imagine from these figures that the future of this industry was started to be questionable. At the same time, and there are a few reasons for that, and maybe I come back maybe to the questions around that, but at the same time, the public opinion on the concern about the safety of the drugs has increased dramatically. So when, on one hand, it's somewhat more difficult to find new drugs, maybe partly because some of the main drugs have been discovered on some therapeutic areas, even if there are many which are still well uncovered, the industry has been facing huge increase in regulatory hurdles, so difficulty to get approval for these drugs to come to the market. And this led to both a level of failure in terms of discovery and research, which has continued to be very high, but also led to increasing cost in terms of research and development, i.e. in terms of clinical trials. So that's on the ability to renovate the business, rejuvenate the business. On the other hand, the second challenge was around cost. And we all know that the cost of health is an issue around, let's say, at least the developed world, that Europe and the US have tackled this in a slightly different way. Europe has tackled that mainly after having implemented the welfare state, now 50 years ago, through a lot of cost containment measures. So as an example, I would say that if I take Europe, and here I would maybe more speak about Western Europe, we as an industry see our prices being reduced on average by 4 to 5% per year when we are never able to increase our prices. So it tells you that this is also a challenge. When it comes to the US, where I'm a bit less of a specialist, so maybe some in this room are more specialists than I am, well, here, the route has been somewhat different, but still we have faced some price reductions or increased taxes in connection with the healthcare reform, which was passed now 2 years ago. So, basically, we had really a difficult decade, and we tried to tackle that. And tackling that led to a different type of strategy, which I've tried to summarize on the right-hand side of the slide. So first of all, expand geographically, and I will come back on that. Second, diversify, so go out of prescribed drugs and go within other areas, such as non-prescribed drugs, such as vaccines, or such as also activities like animal health, which clearly is not a regulated business in the same way as the human drugs is concerned, and increased business development, which means in fact increased consolidation on acquisitions. And last but not least, a new approach to R&D. Well, as a CFO, there is a simple way to look at what the challenge the industry has been facing is just look at the PE ratio. So here you see where the PE was in 99, 2000. So we were above the 30-time multiple. So clearly the expectations were extremely high on this industry. And there was a view that it should expand largely over the coming years, where actually it has not happened. And you've seen that progressively PE have reduced dramatically down to below 9 times, which was the case just after the 2008 financial crisis. So interestingly, this is the time when I joined this industry, so I thought that it was time to reverse trends, which we did a bit, as you can see, since that time, and trying to renew the model on somewhat different paradigms. Well, so on one hand, I describe all the challenges on the Western world: cost containment, cost of health, difficulty to renew pipe, and to bring new blockbusters to the market. On the other hand, there is an absolutely fantastic trend, which is the increasing demand of emerging market. Well, you would say this is pretty obvious. Yes, it is, but it's still worth reminding us of the importance of emerging market in a sector which is largely dependent upon the number of people you cope with. So traditionally, the industry and the pharma industry has been focusing on the part of the world which could afford to pay for drugs. So typically it was US, it was, let's say, North America, I could include Canada, it was Europe, and it was Japan. So basically 1 billion people in the world. And it has been a debate in the past 15 years on why and how could emerging markets or new countries access to affordable medicines. And it is a debate where also the industry has been highly criticized, not making these drugs available for poorer people. The reality is shifting very quickly. So I said already that the emerging market will contribute to 70% of the overall growth of the pharma industry in the coming 10 years. And this is just to say that we are switching from serving 1 billion people, 1 potential billion patients, to 7 billion potential patients. And some of these patients, not all of them, can afford to pay at the same price as, can the Western world. I was just hearing the commissioner on climate change speaking about Chinese businessmen having to pay for the pollution they generate when they travel for business travels. Here it's a bit the same. If you think that just 400 million people in China and India just alone will get above the average level of $25,000 per year of household income, well, this does give you a view that there's a huge population. Well, 400 million is equivalent to the overall US, more than the overall US and equal to Europe. Birth cohort. In US today, a birth cohort, a yearly birth cohort is around 4 million babies per year. Europe is basically the same. China is 13 million. India is even more than that. So, that's really a big shift. At the same time, this population is moving into cities and having a lifestyle which are more and more looking like the lifestyle of Western citizens. Whether you go, if you go to the east coast of China, this is absolutely obvious. But if you go into big cities in Brazil, it's obvious as well. So, not surprisingly, when you meet with the Minister of Health of China and you ask him what are your main concerns when it comes to public health, well, he will spend a few minutes speaking upon rural areas and people living in the countryside, and then he will say, well, my main concerns are cardiovascular disease, diabetes, and cancer. So typically the same issues and the same challenges that the rest of the world is facing. At the same time, on top of this increasing demand coming from emerging markets, and this evolution of the population, you see also shifts in other industries which tend to have some connection with our industry. And it's absolutely obvious, but not that easy to implement, to see that there is more ties between the use of drugs and let's say IT, digital information, remote health management, which definitely will revolutionize the healthcare in the coming 10 or 15 years. Well, I will not be too long, but just to say, because I think I said a lot again, I think that, well, this growth in emerging markets is not without challenges. And here I'd like to mention a few ones. Well, first of all, is the question of protection of intellectual property. For a long time, the industry was very reluctant to go into emerging market precisely because there was no such intellectual property protection. These things are moving progressively. Some countries offer more opportunity now to get protection for IP, but that's really still a question for the years to come. Still, we may face some price controls, which, as we are seeing elsewhere, and clearly there are also market access constraints. So it is all about technology transfer, about manufacturing locally. And it's also about different cultures. If you think about China, 40% of the Chinese medicine market is traditional Chinese medicine, 40%. So how do you get into this segment? Is this segment going to grow? Is there some cultural shifts here? So to really tackle that, you have to have a different type of culture. And here I would say that the European-based companies, because of having an historical, let's say, broader look to the world, tend to have a competitive advantage versus the US-based companies. And you will see, not surprisingly, that European companies have a larger share of their sales in emerging markets as compared to the US companies. Also, there will be changes in the way health is financed, and maybe you will have some questions on that. Well, it's clear that we will see some different model where payers will have to pay more attention to the overall cost of a disease over time. So the question is how you create this type of model and how you finance this type of model. So there are some initiatives, some pilots, let's say, which are taking place either here in the US with private payers or also in some other areas. But I believe that it is a trend which will appear as more and more important. So we see some signs. We see that also government is investing more in the emerging market into health. We see, as I mentioned already, new reimbursement models, and we see an evolution in the let's say in the environment of the research on development. I mentioned already the tie between the biological industry and the high tech or the IT industry. I would say also that we are moving to an industry which was, in terms of R&D, trying to firstly generate molecules and see then what they can target, to look first at the target and to understand in depth the biology of humans, and of course the genomic sequencing is one element in that picture, in order to see and to know which target you should take before generating the molecules. And that's something which I believe is going to be the contributor or main contributor to the increased productivity of R&D in the coming years in this industry. Okay, so here I will just move to one example, which is my company. So we were really going through this trend. So up to about along the last decade, we were focusing on developing new blockbusters. So we had some R&D setbacks, products or drugs which could not go through or which were not approved. And at the same time, we knew that some of our main drugs were going to be come to become off patent and then be in competition with generics. So what we did over the last 4 years was really to try to transform the company in several ways. The first one was to first not just focus, as I mentioned already, on prescribed drugs, but develop other businesses where we are already present, such as prevention, i.e. vaccines, or non-prescribed drugs, but also animal health. This is a diversification. Second, we have emphasized our development in emerging market. And third, we have tried to transform our R&D in order to make it more innovative. And I mentioned some of the elements, and I'm not a specialist, of course, of what makes how the science can change R&D in the bio industry in the future. But also it's a question of organization. The industry over the past, let's say, 15 to 20 years had tried to create big campus where researchers were coming together, not meeting anybody outside, and trying to do the best research. And the outcome of that was very poor. I mean, some people tend to say, well, I mean, the best event in the day in the research center when there was a queue at the parking lot when everybody wanted to leave at 5 o'clock in the afternoon. The reality is that this was really going against the idea that science is complex and that we needed more cooperative, more collaborative research with other partners, being either startups, biotechs, definitely universities, or big hospitals. And this is what in Sanofi we have started to create as from 2009. And in that respect, the acquisition of Genzyme here in the Cambridge area has been an important milestone. So we are heading today into a more promising time where we believe that we are going to grow again on a more diversified basis. Well, to do so, we did a lot of joint ventures. I'm not so sure I'd like to spend too much time on that, but I think that's something which is interesting to see. And we did this acquisition of Genzyme. So why do I mention it? Well, first of all, because this is a Cambridge-based company. This is one of the iconic biotechs which was created in the US somewhere in the mid-80s. And but this is a company which was also facing some more difficulties in its ability to transform from an R&D company into an industrial company. So in practice, it meant that precisely in the plant which is close to this building, not too far from this building, they had some contamination which led to big manufacturing issues, reduction of supply, no ability to provide drugs to the patients they were providing these drugs. And this was for us an opportunity to come and say, well, we can help you because here we have the knowledge. So the idea was to combine the knowledge of a big pharma company which has very good track record in terms of manufacturing, in terms of management of quality, with the innovative spirit of a biotech company. Well, to be honest, succeeding in completing a non-solicited, if not hostile, takeover from a French company on a US biotech was not an easy process, and it took us 9 months, so basically a full pregnancy to come there, and with a lot of ups and downs, like pregnancies, by the way, but finally we succeeded, and we struck a deal now 2 years ago, and it has been really a very important milestone. And I would say that it was really a shift for us, because we tried to do a sort of reverse takeover. So when we had acquired Sanofi, Genzyme, well, we could say that Genzyme is a much smaller company than Sanofi. So the first thing we wanted to do was not to Sanofize this company. In other terms, not to create the bad administrative processes which they could inherit from us, but give them some more freedom. So we took also a lot of time to try to maintain enough autonomy, and to be able to attract these people who used to work in a let's say small medium-sized company, and wanting to stay with us. I must say that after 2 years we have been highly successful, and I would say that not only we have lost just a few people, but we have been at the same time able to bring back the industrial issues back to normal, and resume both sales, providing drugs, and growth. Well, before concluding, so just to tell you a bit, this is summarizing our strategy. So we are using this is a bit the Michelin guide of Sanofi. So we have the 3 stars, the 2 stars, and the 1 star. And well, I will not enter into all the details, but just to tell you that, well, in fact, 3 stars mean double-digit growth, and the 2 stars mean high single-digit. Well, the idea here is to say, well, this was a company which was mainly focusing on declining blockbusters. We try to really transform it into a growing company, tackling diverse targets, and each of them having a leading position. So in each of these business lines or activities, we are either number 1 or number 2 or number 3. And I think this is also one of the way as a lesson to handle a large corporation. Well, so far so good. So as a CFO, I'm pleased by the performance of the share price. Well, this is just a sign. I mean, the market is what it is. But I think the stock market, at the end of the day, can have a reasonably good understanding of a strategy, and assess what is the value which we are created. So just one figure. As you saw, we have acquired Genzyme for $20 billion. Since we acquired Genzyme, the market cap of Sanofi has increased by $40 billion. So if it is just a very simple metric, I must admit, but it just tells you how you can create value in this industry. Okay, with that, I'm really ready now to answer to questions. Thank you.
Well, thank you, Mr. Contamine. I think, well, I'll be very keen on opening up to the audience as far as Q&A. I mean, maybe kick off, and in being the spirit of being inclusive about the fact that there's an audience from sort of corporate interest, but also from the more government-related one. I wanted you maybe to talk a little more, perhaps, about you mentioned sort of the cost containment issues, and I would say in general the public discourse here in the US has been fascinating for a Western European about sort of the Obamacare and the how central cost containment is with respect to healthcare, because we take that as granted as Western Europeans. But as I said, it's very fascinating. But I'd like to understand, how do you see your challenges and responses going forward to the governance challenging that you are facing?
Well, it's a wide topic on a wide question. So if I understand well your question, or at least one angle of it is it's about how I mean, health can be financed in a defined country, and how can you manage and monitor health expense in an efficient way. And I mean, the analysis, if you here, I mean, you really see a discrepancy between Europe and the US to take these two main markets. And well, I would say, for me, I mean, none of these two are absolutely ideal, even if I do understand what is really driving the evolution. So if I start with Europe, basically since let's say since over the last 10 years, the overall concern in Europe has been really to contain health expenditure. Firstly, because health expenditure in Europe is 95% financed by the government. And it boils down to the question of cost of fringes, labor cost, and the rest, and even started earlier in some countries like the UK. I mean, on one hand, the outcome is positive from a, let's say, from a pure financial standpoint. If you look at the health expenditure to GDP ratio, it tends to stabilize in Europe, even decrease in some countries, despite of the fact that the growing age of the population is leading to increase expenses. I mean, if I just look, for instance, at and I can take an example, the French drug market last year overall has declined in value. So how did they get there? They get there through a lot of price containment measures, some restructuring in the hospitalization, and a lot of de-reimbursement. I think that, to me, it's a bit of too much of an accounting management of health. I mean, health is a key issue for people. I mean, if you just think about any of your relatives having a serious disease, I mean, you really start to see that this is something you would be ready to pay for. And something which is more too much driven by, by public debt issue, to me, leads to some limits. And it's fair to say that time passing, there are, if I speak for the drug part or the medicine part of the overall cost, you start to see that there are drugs which are not anymore available in some European countries. And then you start to see that, well, only the ones who can afford to pay for these drugs on their own, I mean, will try to get them, when the ones who cannot afford to pay will not get them. So there is, I believe, a first limit here. The second limit, and this is what we really are trying to argue with the European authorities, with variable success depending upon times, is that, I mean, the reimbursement schemes for drugs need still to give room for paying for innovation. And you may know, being here in Cambridge, that, and being for some of you on the business side, or some of you on the other side, that the biotech industry is struggling to find new funding. The reason why it's struggling to find new funding is that, in fact, the probability of success versus the return is not high enough. And that there are more attractive industries, like maybe the high-tech, where there is also, I mean, there is a lot of innovation, but the time to market is easier, or the constraints to get to the market are easier as well. So the limit today we are facing in Europe is that the prices and the constraints which are put on the industry are such that the attractiveness to work on innovative drugs tend to be lower and lower, and that basically no new innovative startup in the biological world can think without thinking about the US market. So, and here there is a strong tie at the end of the day, because in fact, if you are, a biological researcher coming from a good university from the UK or from France, and if you want to create your own startup, either you come here in the US, or then you start to hope that you will manage to find a way not to access the US market, by basically to at what stage to sell your drug to one of the big European pharma before it comes to the market. So at the end of the day, have indirect access to the US market. Now, if I come to the US, it's a bit the reverse, I would say. I mean, to be fair, I mean, it's clear that the US has failed to control its healthcare expenditures. I mean, the ratio of healthcare expenditure to GDP is going close to 16%, which is extremely high. And it shows that the liberal model, which basically is the main model in this country, has some advantages, but also has not led to really high efficiency. So I tend to believe personally that the future should be somewhere in between. I hardly see if there is enough dialogue around that. So it's around a type of, some type of public, well, we could say public-private partnership in a way, or at least attempts to see how we can have the right balance between a liberal model, free access to health, but at the same time an affordable price for this health. And I think this is something which remains to be invented, and I think I would welcome some young students or young fellows to work on that topic.
Okay, anyone has a question? Please come over.
Thank you very much for your talk. So I have a question about So I was wondering, a few years ago, Genzyme was more specialized into neurological pediatric diseases such as Gaucher disease. So my question is, how do you shift this type of company to broader fields such as cancer disease? What's the mechanism?
You don't shift. In fact, you specialize. Huh? So I think that's one. Of the. I know that you are going to meet today a few executives from corporates, and I think that in big corporation, and there was Mr. Nani Becali earlier today in this room. One of the issues is how you get the best of several worlds. Huh? And the best of several worlds is to leave enough autonomy or enough focus of your let's say divisions or your activities, while taking advantage of size, access to global markets, which offer big corporations. So I believe personally that it is one of the highest challenge big corporations are always facing. And from time to time you wonder, do we create value when we integrate smaller companies into big companies, or do we destroy value? And the metric is not that obvious, and the answer is not always obvious. There are many examples where, on the contrary, on the street is pushing for that, where you tend, on the contrary, to split entities in order to make them more efficient. So in the case of Genzyme, what we did is the following. In fact, Genzyme was a mature biotech. So Genzyme itself was a very focused activity on orphan drugs, coping with very rare diseases, touching a limited population, with high, complex science being involved, definitely, and being then very patient-centric, meaning that, in particular, you mentioned the example of the Gaucher disease, which was at the origin of Genzyme. Basically, in Genzyme, they know each and every of their patients, even if they don't do directly with the patients, because they go through physicians. So I think here there was a unique culture that on which we try not to lose, but on the contrary to build upon. So what we did is that we took out of Genzyme what was not part of these. Typically, they had some activity in biosurgery, which was a different business, which had acquired precisely to balance their portfolio. So we plug all that into Sanofi and try to leverage our global platform to increase sales in some areas where they were not present. On the other hand, we left them autonomous on all what is linked to rare disease, and we gave them the mission also to develop our franchise in another area which deserves some more patient-focused approach, which is multiple sclerosis and more generally autoimmune disease. So, as a coincidence, Genzyme had in this portfolio a multiple sclerosis drug, which is now close to be hopefully to be approved, and we had one. So we put all them together, and we have we asked them to precisely develop this disease. So I think they developed this drug. So I mean, basically trying to specialize people what they do the best, and while you try to generate the synergies by sharing all the back office, you know, trying really to maintain this innovative and pioneering spirit, let's say, that Genzyme used to have.
Okay. So, as it turns out, I think we are already, we can take one more question, so I guess you'll have this privilege. Go ahead.
Monsieur Contamine, I have a quick question about the way you want to deliver pharmaceuticals into the emerging markets. Is that going to be through the local partners, or you want to establish on the ground presence?
No, so it's a good question. So the answer is we want, and we do supply drugs directly, so not through partnerships. And here I would say that to tackle the emerging markets, there are really two main ways. The first one is to have what I tend to call the colonial approach, which is that, well, I have a drug, I produce it somewhere in France or in Germany, and I sell it, and I sell it at the same price, and I sell it at the same price as I sell it if not in the US, let's say in Germany or the UK. Or I try to have more of a customized approach to each and every market, which, and we have developed the latter, let's say, largely historically, so it's not just us who invented that. It comes back to the 50s or the 60s, where our ancestors, being German companies like Höchst, or being a French company like Ron had approached emerging market. And it gave us, I believe, a competitive advantage versus a number of our competitors. So today we have a large part of what we are selling in emerging markets, which are not more patented drugs, which are produced in these markets, so we manufacture locally, and they tend from time to time to be very much adapted to this market, or let's say at least to their habits of life, their practices, and knowledge of brands as well. So for instance, if I go to Brazil, the first product we sell is not a Sanofi product, it's really a Brazilian Sanofi product, let's say. At the same time, of course, we are also selling and providing our more innovative drugs. Access is not always that easy. If you, for instance, take China, you don't get access to China if you don't get approval from the equivalent to FDA, which is SFDA in China. And SFDA will give you approval only if you've done enough clinical trials on Chinese patients, which means that you need also to anticipate early enough, so that if you want to access China with a new drug, to do also the clinical trials at this stage to comply with the Chinese requirements. So in short, I think that and I think that's a good question. I think that the way to not only access but to stay long term in these markets is to be as local as possible. And it's really what we try to do also in terms of management, as I say, in terms of manufacturing.
Okay.
Thank you.
Well, thank you very much. We're running out of time, so thank you again, Mr. Contamine, for sharing your thoughts on the evolution of Sanofi into a global healthcare provider. And I hope that maybe some will be able also to talk to you. But thank you very much.
Thank you, all of you.